The reduction of prices of essential drugs was taken following research which showed that 74% of Ugandans depend on free government drugs for their treatment, not from their own pockets. It is why Glaxo Smithkline, an international pharmaceutical company with a foothold in East Africa, has now decided to cut down prices on its patent medicines in all less developed countries. The company says this is to help improve access to quality health care in the countries and curb neglected tropical diseases.
Because of the hot climate and the hygiene issues, we have a lot of problems like diarrhea, worms, respiratory tract infections. Most pharmaceutical companies try to make a little more research on diseases of the rich than the diseases of the poor. So GSK is saying we need also to pay attention to the neglected tropical diseases.
The reductions of up to 50% in prices are for Bactroban cream and Bactroban ointment for skin infections, Ventolin, an inhaler for asthma patients, Zentel for intestinal parasites, and Amoxil, an antibiotic. In 2010, the cost of antibiotics such as Augmentin, Zinat, and Savarex for cervical cancer prevention were cut by between 30 to 40%. In 2009, the prices for Avamis, a nasal inhaler, Malanil, an antimalarial, Avodat for halting prostate enlargement, Seretide for asthma, Utiva used in surgeries, Flixonase and Flixotide used against allergy and nasal congestion were reduced by 80%. The World Health Organization, WHO, reports that the risk of a child dying in a low-income country before completing 5 years of age is 17 times higher than that of a child from a high-income country. Each year, 1 million children die of pneumococcal disease, especially in developing countries. Vaccination is the only tool to prevent the diseases. Second to malnutrition, nearly 1 in 5 deaths among children under 5 globally, about 1.5 million, die each year due to rota-related diarrhea virus. Today, only 39% of children with diarrhea in developing countries receive the recommended treatment. GSK plans to cut the price for rotavirus vaccines by 67% a dose in poor countries, or just $2.50, roughly 6,000 shillings a dose. In the developed economies, a dose would cost $50, roughly 120,000 shillings. Already, asthma and pneumonia treatments have been cut by half.
In a nutshell, we are trying to reduce prices across the range of our pharmaceuticals and vaccines.
Glaxo Smithkline cites the high cost of drugs as the major reason for the proliferation of counterfeit medicines, which pose a health risk to patients who do not know their adverse effects. Together with other major drug companies, they believe significant price reductions can lead to access to better quality and more genuine medicines in poorer countries. Florence Nalimba, NTV.